All right, so this is actually really wild, and people want to stay and watch this whole video because when I looked at these charts and some of these numbers, I was really surprised. And so let's just jump right into it. So between 2021 and 2022, the Medicare Advantage enrollment grew by about 2.2 million beneficiaries. That's a lot of people, or 8%. There was a slight lesser growth than the year prior, which was 10%. So it was over 2.2 million the year before. So they are on the rise. I mean, look at this right here, this chart. We're talking about 2010, 25%, all the way to 61% in Medicare Advantage enrollment. Now, we'll see here. You can see the chart up top is the traditional Medicare, and then down here is the Medicare Advantage. I mean, but 61%. Oh, I'm sorry. Here we are. 52% is what it's at, and 48% traditional Medicare. So Medicare Advantage is bigger than original Medicare with a gap plan and a drug plan, vision, dental, and hearing separate. I've talked about this in many videos, so let's get into the challenges and the differences between these plans. But the first thing I want to show you is some of the Advantage plans that are the top plans throughout the entire country and why they're so popular. Please leave a comment in the description box below if you're on one of these plans or a different plan and tell your story. A lot of people have given me feedback that the comments have helped them, so please leave your comments below. All right, let's check it out. So Medicare Advantage number one. Now, I put this in here because this is from my hometown, one of the plans. And it's funny, I was talking to another agent today on the phone, and she was telling me that the only, what it was, not, she said something really funny, but it was like the only gig in town or something like that was this plan. I don't want to mention any names to specific companies, but I think you can kind of figure it out. So back in my hometown, which is Philadelphia, this plan is unbelievable. A lot of clients are on it. Everybody loves it. They don't have any problems with it. And I asked this woman, so what do you see about problems that people had? She said there's only one thing that I see when they hit the max out of pocket, which is this 7,550. She said the only time I've ever seen that in the last 5 years is if somebody had to have cancer treatments. And I said, okay, well, what about if they don't have the money for this? And she said, honey, let me tell you something. She said, the hospitals up here are getting so much money from charities and different things like that. I've had clients that haven't paid a hospital bill. She goes, yes, they're charged something or whatever, but the hospital has waived it because they cannot pay it. So she absolutely loves this plan up there. Comes with dental, vision, and hearing. Comes with a drug plan. It's a zero premium PPO, which means the network, you can go outside of network, inside of network, but there's something like 84,000 doctors on this plan in network. And hospitals, she said, you're going to have to stretch to try to find a hospital that doesn't take it. Throughout 5 counties up there, all the hospitals take it. So let's move on because I've gotten comments and I want to address these about the other Medicare Advantage plans in different parts of the country. I do specifically remember someone telling me about a plan in Florida where the max out of pocket was $1,900. It was a zero premium plan. So I wanted to go over one of the plans that I saw that was very interesting was an HMO plan for a zero premium. Now look at this. The difference between the hospital coverage of this first Advantage plan, they both have a zero premium as you see. 1, 2, and 3. Now the hospital for this PPO, the first one is $250 a day. For this HMO, it's $50 a day. Now let's look at the doctor, and I'll go over the difference and what I think after this. The doctor, it's $35 to go to a specialist. Sorry, I keep moving this thing, and $5 to go to a specialist with the HMO. Now the third plan is another PPO. And it's a different plan, and it's $295 to go to the hospital. But if you look at this max out of pocket, that will explain why some of these charges are more or less. So let's look at the doctor. 35, 5, and 5. CAT scans, the first one, the top one's $300. That's what they do charge. But the HMO down here, now let me slide this back. The second Advantage plan, the HMO, is $25 to get a CAT scan. And then, I apologize. I keep moving this thing. It's probably driving people crazy. The max out of pocket for this plan, the HMO, is $1,900. Now look at that, $7,550 compared to $1,900. $1,900, that's the max that you would spend. Most of the time, you're not going to. What are you going to spend it on? Doctors, $5? CAT scans? No. Skilled nursing, you get 20 free days for free. But let's go to the third one, and then I'll get into what I think about these three plans. So the third one is a PPO in a different area, $295 instead of $250 for the hospital. Both $35 for specialists, $0 for your primary care. But this one has $110 for a CAT scan, which is much cheaper, obviously, than $300. And then the max out of pocket is $4,900. So I'm saying to myself, well, wait a minute. What's up with this max out of pocket, $7,550, $1,900, $4,900? Well, this $4,900 is in network. The actual maximum out of pocket for out of network is $8,900. And that just tells me that the network is smaller. Now for this, the max out of pocket is $1,900, but I can tell you that this network is going to be very, very tiny. So the people that want to use this plan literally want to be within 10 miles of the hospital and all their doctors and outpatient centers that they're going to use, because this is going to be the smallest network that you're going to see. So why are Medicare Advantage plans so popular in the past couple years? Well, number one, their premiums, a lot of them are $0. Now, 10 years ago, the premiums used to be $100 for these plans, and the copays were much higher. And the out-of-pocket, I can't remember what the out-of-pockets were, but they were much higher than $1,900, I can tell you that much. So let me know in the comment section below what your plan is, what you're on, what you're looking at. If you tell me what you're looking at or what you're on, other people can comment, and I can actually look up the plan also and comment myself about what I think. Thanks for watching the video, and I'll see you at the next one.